My medication is about $100 a month.
Hannah has an autoimmune disease. This cocktail of daily meds are keeping her alive.
I sometimes find my illnesses and managing them is like my part-time job. I have to go to the pharmacy at least once a month to get all of my medications. I have to make sure my scripts are current.
But from September, it's hoped life will get a little easier. Instead of getting 1 month's supply of meds from the pharmacy, people like Hannah will be able to get 2 for the same price.
It would be amazing not to have to think about it every few weeks.
The move will effectively halve the cost for about 6 million people with chronic conditions by cutting back on the number of times they have to fork out for the PBS co-payment. That's about $30 per script, saving about $1.2 billion in fees over the next 4 years.
As a result, over the past 5 years, patients with chronic disease have literally shelled out hundreds and hundreds of millions of dollars in co-payments that they didn't need to shell out. We're going to put an end to that.
This is great news for GPs and their patients. This is going to make medications cheaper and easier to access. It's going to free up those appointments at the GP clinic.
Over 320 medications will be on the new plan. But the National Body for Pharmacies is pushing back.
This, unfortunately, is just smoke and mirrors.
Warning the new deal will only deepen the drugs drought.
There are already 472 medicines in Australia that are either critically short or just completely unavailable.
Take advice around medicine supply, medicine shortages from our medicines authorities rather than the pharmacy lobby group.
The Health Minister says only 7 drugs on the new scheme are listed as having supply issues, rubbishing claims that chemists will be cleaned out.
Well, I think that's just a beat-up. This is not going to increase the number of drugs dispensed. It's going to change how often they're dispensed.
So is this new pill policy reason to party, or are pharmacists' fears well-founded?
This is about their bottom line. It's not about what's best for patients. It's not about trying to save people money.
Well, for their thoughts now, we go to the Pharmaceutical Society of Australia's Associate Professor, Chris Freeman. Chris, thanks very much for your time. You heard there, the government says only 7 of the drugs on this new scheme have supply issues, so why the concern?
Well, look, I can tell you from the pharmacists that I've been speaking to over the last couple of days, the out-of-stock medicines are much more significant than that. And we've seen out-of-stock medicines happening all the way through the pandemic, and I'm sure your viewers tonight will have gone into pharmacies, tried to get prescriptions and not been able to get that particular medicines.
Is there a part of this as well, though, where pharmacists are just worried about their own profits?
Well, I think the challenge with this is that many of the services being provided in pharmacy, and I'm sure many of your viewers will have gone into pharmacies and had their blood pressure checked, would have had their medicines delivered to their home, would have been in an aged care facility and had their medicines delivered urgently. All those types of services are offered at a very low cost or for free through pharmacies. And with the impact of the reduced revenue from the government into pharmacies, many of the pharmacists that I've been speaking to today are really concerned that they may not be able to continue to offer those services at that reduced cost or at all.
But all we've heard, Chris, over the past few years is just how stretched our GPs are, how our healthcare system is massively under pressure, how low-income earners who have chronic illnesses can't afford their medication. So isn't this part of the solution?
The problem with introducing policies like this is it's not a siloed approach. As you said, the primary healthcare system, GPs, pharmacists are under significant pressure, and there are many times where patients are unable to get access to their GP because the appointments are not there. And they've been using pharmacists as a first port of call, and so reduction in funding for these types of services that has flow-on effects to other types of services delivered through pharmacies is only going to exacerbate the pressures on the primary healthcare system. And we're going to see more and more patients turn up to the ED departments, which are already overfilled and clogged at the moment.
But they may not go to the ED department if the GPs suddenly have vacancies because space is being cleared up by this new regime for prescribing.
Well, I think we don't have the access in the health system to cope with the demand at the moment. And we know that demand for healthcare services is only going to increase into the future. We've got an ageing population, we have more people taking more medicines, and so we need all hands on deck to make sure that primary healthcare delivered to patients when and where they need it.
Chris, we'll all have a keen eye on how this plays out. Thank you very much for your contribution tonight.
Thank you.